Western Cape we go now, where the health department in that province will vaccinate people living on the streets to curb the spread of the coronavirus. The city of Cape Town says the number of homeless people increased at an alarming rate during the lockdown. eNCA's Ronald Masinda is following developments and joins us now for an update. The irony is not lost on me, Ronald, that this is a city where we see controversies from time to time about homelessness, the whole issue of shelter, and also the whole issue of, housing, for example, cropping up from time to time. But at the same time, we are seeing that this is the province where you are actually seeing movement quite early on in the vaccination phases to vaccinate homeless people.
Yes, indeed, Tulas. Well, MEC of Health, Noma French-Mbombo, has just concluded her visit where she spoke to various civil society groups on what some of the challenges could be with the vaccinating people who are homeless. And one of the main challenges is really the issue of people not having IDs, people of the ages of 50 and 59. We've also been hearing several reports of people losing IDs whenever a City of Cape Town law enforcement came to clamp down on them. But just for more reaction following the visit of Noma French-Mbombo, I'm joined by several people. I'm going to start off with Mr. Abdul Smith. He's been living on the streets for over the past 19 years. He's age 60, and you say, sir, that you do want the jab. Tell us more about the challenges of living on the streets and just your hope of, being vaccinated.
Sometimes I'm hungry or whatever. I go out by the people and I knock on the door. I ask for garden jobs or paint jobs or anything they gave me, or clean the windows. So I earn, that's the reason I earn money to buy me food.
In terms of the awareness, how well aware are you of COVID-19, and has it impacted you badly?
Very bad, because the asthmatic, my lungs getting cold, so my lungs is so I don't like that the weather, whatever is in. But sometimes I feel like I stay in my tent.
Thank you very much indeed for your time. Abdul Smith also stays with his wife on the streets, Tulas, just mentioning the difficulties of the Cape winter. It's very cold, and that he's asthmatic, and he's also experiencing quite a number of health issues. I'm going to bring in Carlos Musqueta to the conversation. Carlos, you have been representing a lot of people living on the streets. Talk us a bit about the claims made in terms of the issues people may face in not having these IDs.
Okay, well, obviously the biggest issue is the ID, and the MEC has now committed to speaking to her partners in other departments. Home Affairs is obviously the most important one, so that we can try and solve that big challenge. I mean, without that we are going to struggle to get this done.
Now, of course, last year during the hard lockdowns, we saw the City of Cape Town as well as national government on a drive to ensure that people don't live the way that they are living, and that there were quite a number of campsites that were established. Should we see more of these initiatives?
Definitely not. Not the Strandfontein setup. Putting 2,000 homeless people together that are not, it's not a homogeneous group. And Strandfontein proved to us that should never have happened. So I'm grateful that they haven't tried that for level 4. And although this is not optimal, what you're seeing behind you is not optimal, it's better than it was at Strandfontein, because people can still maintain distance, which we couldn't do at Strandfontein at all.
Okay, we're going to wrap up very shortly, but in terms of what we heard from the MEC saying that there were not enough awareness programs for the homeless, how well equipped in terms of the knowledge that people have with regards to COVID?
It's very, very limited, and it's limited to what we've been able to do. We as SHAC have gone to a number of groupings and explained to them what the vaccination is about when we were doing the over 60s. But we have found that, as we progress, there's less and less of education, basically. Most homeless people don't have access to the television and radio, and so there should be a drive. I mean, before the vaccination, there should be a drive. Otherwise, they're going to have people rejecting the vaccination, because on the street, it's mostly rumours and it's based on, myths that have been formed around the COVID vaccine. So there's going to have to be an education.
Very much so. The awareness programs are very much needed here on the streets. I'm going to quickly just have one more guest, a quick word with you, Reverend eNCA. Thank you so much for your time and just your reaction on the MEC's visit.
Yeah, we're incredibly grateful that she could come through to us today. We had some correspondence with her. We were really concerned. As part of the Street People's Forum, there are 26 organisations who are supporting homeless people, as well as the Strandfontein Homeless Action Committee. And so collectively, we wanted to raise this issue of needing IDs to register for the vaccination, and the fact that just through our own surveys here at the Hope Exchange, out of 98 people surveyed, 59 did not have IDs. So we recognise this is an issue. It doesn't just apply to the vaccine, although that's critical. It applies to accessing other health care and also to register for the vote in the municipal elections this year. So we recognise that for homeless people, their constitutional rights are undermined when they don't have an ID. And so it's really critical that we work together, and if government can really assist in working together to reissue IDs so that people can register for the vaccine and other things.
Right, Rev, thank you so much indeed for your time. That was eNCA, Reverend at the Hope for Exchange, talking to us a bit about some of the conversations that she had with the MEC. And of course, one of the biggest concerns to us is the issue of IDs. We do know that the MEC's office will be in conversation with the Department of Home Affairs in trying to sort out many people who are without identification. Talking to Abdul Smith also earlier on, he says that, he's been living on the streets for over the past 19 years. He's at the age of 60. He also doesn't have an ID, and there's no knowing whether or not he will receive a jab. He does want one as well, with his wife, who he's been with on the streets for nearly 20 years.
All right, thank you for that update. That's eNCA's Ronald Masinda out in the streets of Cape Town, unpacking the complexities and the difficulties of being homeless and living on the streets in a time of COVID-19 and in winter as well.